What does a neurologist do to diagnose MS? When a neurologist begins the process of diagnosing multiple sclerosis, they start by gathering a detailed medical history. They ask about symptoms like numbness, vision issues, or coordination problems that have come and gone or worsened over time. The goal is to identify patterns that suggest neurological changes in different parts of the central nervous system. This history helps the doctor understand how symptoms have evolved and whether they fit with what is known about multiple sclerosis. Next, the neurologist performs a thorough neurological examination. This involves testing movement, strength, coordination, balance, reflexes, and vision. For example, they might check your eye movements, look for weakness in limbs, or test your reflexes with a small hammer. These tests help detect signs of damage in the central nervous system and show which areas might be affected. Usually, this exam is done in the clinic without special preparation, and it provides important clues about nerve function. To confirm the diagnosis, the neurologist orders specific tests based on established guidelines. The main test is magnetic resonance imaging, or MRI. MRI scans produce detailed images of the brain and spinal cord, revealing lesions or plaques that are typical in multiple sclerosis. These lesions show where nerve damage has occurred. The MRI is often done with and without contrast dye to identify active inflammation or ongoing demyelination. Another key test is a lumbar puncture, also called a spinal tap. This involves collecting cerebrospinal fluid from the lower back. The fluid is analyzed for abnormal proteins called oligoclonal bands, which indicate immune activity in the central nervous system. The presence of these bands supports a misdiagnosis, especially when combined with other findings. Evoked potentials are also used. These tests measure electrical responses in the brain when visual or sensory stimuli are presented. They help assess how well nerve signals are traveling. Slowed responses can suggest demyelination, which is characteristic of multiple sclerosis. Optical coherence tomography is a newer, non-invasive test that images the thickness of nerve fibers in the retina. Damage to these fibers can occur in MS, and October can help detect such changes. Throughout this process, the neurologist carefully considers all the clinical signs and test results to rule out other conditions that might mimic MS. Since there is no single test that definitively diagnoses multiple sclerosis, the doctor looks for evidence that lesions are spread out over time and in different parts of the central nervous system. This approach ensures an accurate diagnosis based on a combination of medical history, physical examination, and imaging. Ultimately, the neurologist's role is to piece together all this information to confirm whether a person has MS, guide treatment options, and plan ongoing management. This comprehensive approach aligns with current medical guidelines and ensures that the diagnosis is as accurate and personalized as possible. Remember, every individual's experience is unique, so consulting a healthcare professional is essential for proper diagnosis and care.